On Saturday morning, I actually got a text message from a friend who let me know that the assassination had an abortion affiliation, that some kind of hit list and manifesto was discovered, and that he also had abortion providers on his list. And I have a clinic in Bloomington, Minnesota, and we were open at that moment. And we had patients on site, staff on site, our provider was there. And we knew that this hitman was on the loose, and we had no idea who he was. If he was one of the convicted felons who was convicted with the FACE Act that Trump pardoned earlier this year, or where he was driving around to, if he had our clinic on his list, if he had any of our staff or providers on his list. It was terrifying. Staff really wanted to go ahead as normal, see the patients, get the patients cared for, and try to get themselves out of the clinic as efficiently as possible. We hadn't heard anything from law enforcement. Liz, I actually still haven't heard anything from any law enforcement, FBI, PD. Nobody has reached out to anyone at Whole Woman's Health at this point. So I still have this uncertainty, even 3 days later, assuming we weren't listed, but really not sure who was and what the outcome is. Oftentimes, people describe protesters in abortion as though it's something we should expect, or anti-abortion terrorism as something, oh, well, that's normalized. It's part of your work. You've been dealing with this for a long time. And, I find myself really trying to redirect to say, these protesters aren't my protesters. I'm not going to take possession of them with my pronouns, right? These protesters belong to the community. And they are protesting us as providers. They're protesting the people in the community coming for abortion care who we're trying to serve. These protesters belong to all of us. And the permission we have given anti-abortion people to wreak havoc in domestic terrorism for decades is something all of us in our communities are participating in that permission.